Welcome to BizTech's Asia's hottest startup show. Our guest for today is Shravan Verma. He's the Chief Executive Officer and co-founder of Speedoc. Now, Speedoc was founded in 2017 and is a virtual clinic and healthcare solutions platform that allows users to seek medical care and services right from their homes. Now, to tell us more about this, welcome to the show, Dr. Shravan.
Thanks a lot, Brian, and real pleasure to be here.
Now, Shravan, could you give us an overview of Speedoc and the reason why it was founded?
Sure. So we really started Speedoc with the aim to push the boundaries of healthcare beyond current times, whether it is looking at how conventional healthcare delivery systems are designed, the use of technology in the industry, or even the standard and quality of patient care. So with this in mind, we really wanted to be able to create this new model of care where we can bring hospital level care to everyone, no matter how far or where they are located. We feel like they should still be able to get that same high quality of medical care people usually get in the four walls of a hospital to be provided to them at home. And with this, we've been able to offer really this almost like an unparalleled breadth of home and digital healthcare services, managing acute conditions, chronic conditions, even preventive and urgent care services to palliative and oncology care services. And this is what has allowed us to really run and operate this fully comprehensive 24/7 hospital at home care service, which allows patients to recover and be treated in the comfort of their own homes.
Okay, so Shravan, let's take a step back because give the audience an insight into your background and then how the pieces of the jigsaw puzzle then fitted together.
Sure. So as a background, I'm actually a locally trained and studied doctor in Singapore. I went to medical school at Duke and US, after which I was practicing in the public hospital system and did family medicine. And that is where I realized while working in some of those emergency departments that people would be coming to hospitals for conditions that I felt could have been treated in a outpatient or even home setting, a community setting, but there wasn't any means to be able to do that. While home visits have always existed, it usually would be a very silo, very fragmented, one doctor or two doctors just going around, not really integrated into the ecosystem. So this is really where we saw almost like a gap where if we could provide a very high quality, high standard level of care to patients at home, it could really help to shift what conditions are being treated in a hospital to be done at home.
And that really is the crux of it, isn't it? Because healthcare systems around the world, and whether it's in Asia, whether it's in North America, they are currently overburdened, especially public health systems. And this really from a thesis of elevating the pressures for all of these non-essential sort of consultations to be done remotely by telemedicine.
Exactly. The whole, I would say, traditional healthcare delivery system has these challenges of overcrowded hospitals, this perennial manpower crunch, which has impacted the healthcare system's abilities to deliver this very high quality of medical care. And now we're facing this whole problem of aging population across the region, right? In Singapore and other countries, Japan, Korea. And it's really that whole shift, even in the demographics, will put even a higher burden on the hospital infrastructure and hospital system. And over the next 5 to 10 years, we don't think like the capacity to keep on building more and more hospitals will solve the gap for this additional increased need for this aging population, which is why we felt it was so important to be able to create a model and a system like this, which can help augment the hospital's capabilities, manage patients at home, and with the same quality and high standard that you would expect in a hospital to be treated at home.
Okay, then, Dr. Shravan, that's we understand now you've presented it very clear, the whole thesis around this. How about the execution? What are the services that you're offering from a home care perspective versus virtual hospital type services that you provided on your platform, Speedoc?
Yeah, no, and it's very interesting too, right? Because there are a myriad of different healthcare services available. There are, we've heard a lot about telemedicine and just video consultations, right? Which are great to solve those simple cough, cold, flu, runny nose. If, people just need a MC for their illnesses, it's a very convenient way. But anything more than that, where patients need to be reviewed or examined, they're asked to go to a clinic or a hospital. And then that doesn't really help alleviate the burden on the hospitals. So this is where to really make or execute this home hospital model, right? We needed to combine video consultations, combine home visiting doctors, home visiting nurses, combine remote patient monitoring, and combine medical transportation and ambulances, and plug it really into the ecosystem to be connected to hospitals, to be connected to imaging centers. That really makes it more of this complete one-stop integrated platform, which allows us to be able to deliver that same range of ancillary services and care that would be needed in a hospital to be done at home. And it's really this combination of integrating remote patient monitoring, home visiting doctors, video consultations in an easy to use way to be able to manage patients at home.
Now, this is really interesting because obviously that's quite different from what some of the other virtual online providers who are in the same space are providing. Your differentiator seems to be the fact that you're integrating hospital services into your platform. Am I correct with that?
That is absolutely correct. And when you think of it, right, the complexity of these conditions is a lot more than what you would typically deal with those video consultations. For example, we are managing conditions like dengue, heart failure, pneumonias, skin infections, cellulitis. We're even doing now cancer care and oncology care. And we really believe the range of these conditions that we can manage under this model of care will continue to increase over time. As technology develops, as the remote monitoring capability develops, or the logistics improve, we can do even closer and closer monitoring to the point where we really see the end point, right? Is that about 25% of the conditions which are today being treated in a hospital could be managed at home with this model.
And for the healthcare system as a whole, that's tremendous cost saving as well as resource saving, because after all, healthcare inflation is double digits across the region.
Exactly. And what we've seen so far from this model of care, right, is that it's almost about 20 to 30% a lower cost than what a traditional hospitalization for that same exact condition would have costed. So this is a huge saving on the national level for industry partners like insurance companies, as well as for the hospital. So it's really a win-win-win for the ecosystem.
Okay, then Dr. Sharma, let me ask you in terms of your execution. Which countries are you in and who are your partners?
Sure. So we are currently in Singapore and in 8 major cities across Malaysia. In Singapore, we work with almost all the major hospitals, the public hospitals, where they, instead of admitting patients under their four walls of the in their wards, they're able to admit under the same hospital program at home. And we are work as a partner or provider for the hospital to be able to help and manage these patients at home. There's a very interesting initiative done by the Ministry of Health's Transformation Office as well,
And this is the
where
Ministry
they,
of Health of Singapore, right?
that's right,
Right.
yes. So they set up this sandbox for this model of care called Mobile Inpatient Care at Home, or MIC at Home in short. And they are actually studying, reviewing this data, how this could potentially really help all these different hospitals. Instead of these patients being hospitalized in those public hospital, restructured hospitals as well, could be hospitalized at home. And with partners like us, we're able to do that for the hospitals very seamlessly. Because really, when we think about it, right, the hospitals aren't built for this. They don't have doctors and nurses ready to go. They don't have the remote monitoring tools at their disposal. They don't have a call center with 24/7, which will be monitoring these patients. And this is what Speedoc excels in, so that it is really provided as this one-stop solution to these hospitals to start running and operating their virtual wards.
Okay, one of the key things that I see when you build a network like this is electronic medical records. How does that work in this context? Because there are different actors who are populating medical records, and obviously healthcare providers, whether it is your ambulatory care person that goes to the patient or the surgeon in the hospital, needs access to this data. How does that happen now?
Yeah, so we actually have a very, very strong collaboration with electronic medical provider and a CMS provider, which is being used by the clinics in Singapore and Malaysia. So with that partner, we're able to create very seamless integrations into our system. And then we also provide access to our hospital partners to be able to review and manage the patient data when they're under our model of care. And, it's completely cloud-based, so they can just, any hospital of our hospital partners are able to log in and see all the patients under the model of care. They can see all the different things the Speedoc team has been doing for the patient, any interventions that were taken, any medications or anything that was administered. And they have a full overview and oversight. Even the vital sign healthcare data when they're admitted is flowing into that same system. So it makes it very easy to consolidate all the patient data when they're admitted under this model of care in this cloud-based system. Of course, our plan is to integrate this system even with the hospital's own patient medical records. There are some regulatory standards required to be met, and this requires working with even the national healthcare IT institutional bodies to work out how this data can be seamlessly integrated with hospitals' own records. So they just have to view that one system and yet be able to manage patients in this virtual ward model.
Now, could you give us an insight into the technology stack around this? What solutions that you've developed yourself, and what are solutions that you've perhaps integrated and partnered with to make this all of this happen?
Yeah, so we have a very, very strong operational tool built specifically for this model, which is built in-house. This allows us to geolocate where all our healthcare professionals are, see them on a map, where who's active in which areas, centralize and consolidate all their availabilities. As you know, our providers can just set, I'm available at this time on these days, all on their app, which is then managed and viewed on our system. And based on this system, we can easily dispatch, this doctor can see this patient in this location, and then this patient, this nurse can see this patient. All of that is being done digitally. because we're doing it on a very high scale, right? This whole model of virtual hospital, it's all managed in-house. This is accessible by our patient care team. This is accessible by even our call center. Then the strong partner that we have, who we've also helped in development and integrations and connecting to our system, is that EMR and clinic management system partner, who clinics are using as their day-to-day medical record and their day-to-day operations. Anytime patients come, they register, they enter the case notes, they do the prescription, everything on that system. That data flows seamlessly with integrates with our operational platform and data, so that when hospitals use it, they have all the information they need. And soon, we're building out even capabilities, when you order food and you can see your food tracking, where the delivery rider is. The same kind of capability the hospitals have, as well as the users have, to know where the healthcare professional is, what is the status of any blood investigation or investigation that was done for the patient, if any imaging test or diagnostic test was done, what was the result for that. All of that is trackable and traceable digitally, which is what we feel really enables and powers this whole model of home hospitalization.
Okay, I want to take a deeper look at culture, really. So I want to talk about a report by McKinsey, which states that basically around 40% of consumers believe that they were going to be using telehealth moving forward. 11% only from people who thought they were going to do that. This is prior to the pandemic. So the pandemic has really turbocharged the growth of companies like yourselves. What is your view on the cultural aspects? Because you're in Singapore. Singapore is a very digitally native or advanced from a digital adoption perspective. You are in Malaysia, the main population centers, perhaps lesser so. And as you expand, that's going to be more and more of an issue. How are you tackling that?
So, definitely, I would say COVID-19 has been a huge factor in the boom in the telehealth services, as everybody was facing this manpower crunch in traditional healthcare facilities, and consumers gradually embraced this whole virtual concept idea to manage their healthcare needs. And while I would say telehealth was still taking off before the pandemic, it really soared over the past 2 years, 2 to 3 years, with this change. I remember there was the research, by Bain, I think in 2021, which said that telehealth adoption has essentially doubled in 2019, but it also made medical professionals more enthusiastic about telehealth. And even physicians' adoption doubled in 2019, because the initial barriers was not just with patients, but also physicians. And that mindset also changed. And we believe like these rates are expected to grow in the coming years. This whole model of healthcare, I really think, is here to stay. And I think the region is also becoming increasingly aware of the need to build these robust healthcare infrastructure, which is able to mix all and combine a very hybrid model of clinics, hospitals, and online healthcare services that can be accessible from home. So I think this whole line will become even thinner and thinner of, this is what a clinic can do, this is what a hospital can do, this is what online can do. But you combine it, then I think that whole continuity of care is maintained across these different units for patients and users.
Now, Dr. Shravan, this is 2023, with the start of the year. What are some key trends, opportunities, and challenges that you see for the healthcare industry, and particularly the health tech industry moving forward?
Yeah, I would say definitely in the region, sometimes low technological literacy and sometimes maybe a lack of trust in digital technologies within healthcare landscape could be some major issues that inhibit adoption. Also, I would say ensuring the quality and training of healthcare professionals for use and managing under this virtual care. I mean, I went to medical school almost actually more than 10 years ago, and we didn't have anything, any training whatsoever on this virtual or online care. And in certain markets where it's very new to doctors, it can be a bit of a barrier for them to know what they can or cannot do under this model of care. And we feel this change will happen and evolve, and that's what one of our initiatives is always to do, is to keep training, keep a very good knowledge base for all the doctors who are working on our system, so they have a very standard set of guidelines to be able to know what can be done and what needs to be done when patients deteriorate, how do they escalate, how can they manage patients safely in this model.
Now, I want to zoom in on Speedoc as a business now. And
Mhm.
you've just raised 28 million in November from the likes of Bertelsmann Investments, Shravan Venture Investment, Mars Growth, and then Vertex Ventures has also reinvested in you. Walk us through what the strategy is for deploying this capital.
Sure. So what we really want to be able to do is to continue investing in our technology and tools, which are having this virtual hospital model work. Yeah, we wanted to work even more seamlessly. This requires us to invest a bit more on integrations with the hospital systems, integrations with national system, and at the same time integrating even with remote patient monitoring devices and capabilities, so that we can manage patients all through the system seamlessly. The second thing we also want to do is also upgrade our logistics and our training capabilities of any new healthcare professionals that join us. One of the things we never compromise on is patient safety. And we do everything, we make sure all the protocols, fail safes are in place. So when patients are under this model of care, it's very easy to know, if this happens, we send the patient here. If this happens, we send the patient here. And all these different guidelines and training capabilities is what we want to ensure as we are scaling this model to even larger numbers and more markets. And of course, the third is we are setting up in a new market, working with a different new hospital partner for a new market, so that we
Which one
can
is that?
replicate. So we're setting up in Thailand, and we believe the Thailand market is quite diverse and quite expansive as well, different market than Singapore. But working with the right hospital partners, we are able to leverage their capabilities and also being able to deliver this virtual hospital model of care. So I think this is essentially what we will be deploying the funds for. We do see this model works in Singapore and Malaysia, and so far all the data and analytics have been very reassuring, to the point we know we can work to build a really sort of like the largest hospital running entirely through technology and logistics in multiple markets, working with local partners.
Now, Doc, there's an interesting choice in terms of Thailand. Is that partially due to the fact that they have a significant amount of medical tourists, and the likes of Bumrungrad Hospital, which is a high quality provider and treats thousands and thousands of international patients? Was that part of the factor in terms of you choosing Thailand as your next base to set up?
Yeah, that was definitely one of the factors. We see Thailand as a very evolving and booming healthcare industries. There's a lot of different new hospitals coming on board. And there's also a lot of interest in adopting these newer digital tools and technologies. And there's that interest even from the user side. We've seen how adoption, like even digital ride hailing services and all, and food delivery services, and been taken up in different parts of Southeast Asia, but Thailand significantly. And with this addition of this healthcare advancements, we felt it was a very interesting market for us to go next, working with these different hospital partners. The additional reason was also the way the healthcare system is set up. In there, most of the patients, the outpatient department is set up within the hospital. Instead of people always going to clinics, they just go straight to the hospital in the OPDs of that hospital. So, providing them that capability, the hospitals, to be able to manage patients outside the hospital remotely, and at the same time connecting them to the hospital when they need to be admitted or when they need any further escalations or follow-ups, we thought it would be able to add the most value for users with that model. And the third is a bit also the paying capacity. Patients do have the capacity to be able to pay for healthcare services, and often people do pay for better and more convenient healthcare services. So all these different factors is what led us to deciding on setting up in Thailand.
Now, I want to shift the conversation to you as an entrepreneur, Doc. What are some, excuse me, what are some key things that you've done as an entrepreneur in the last 5 years that you think you've done very well?
So one of the things I realized, right, in this whole journey, that having a good idea is, very, very small part of, creating a successful startup or a business. In fact, I would say when you first come up with the idea, it is so important to be involved in part of the whole execution process, in the development of the tools, in seeing how it's deployed on the ground, seeing how doctors are responding. I mean, for the first 2 years, I was the doctor doing home visits within Speedoc. So that was such a great experience for me to know what doctors can do, what cannot do, what do patients expect, what kind of tools can be built around the healthcare professionals and patients to be able to make it more seamless. And I feel that has been very, very important in being able to set Speedoc apart by, us healthcare professionals being very involved in how the solution was created. And oftentimes you would realize, right, that the idea that you first started with is probably not going to work midway, and you have to continuously tweak and adapt and change it based on what you're seeing on the ground. So what the is eventual execution of that idea that takes place can be very different from what you start off with. So I do see a lot of the times, entrepreneurs just think, "Oh, great idea. I think I'm gonna make it work and everything will be great." Is often not the case. And it is, I would always require or suggest entrepreneurs to be really, really involved in the process of execution and development, and making sure capturing all the information, how it's being used and deployed on the ground, so that you can direct the teams to build even more things that people can use, as it's often called in these startup terms, right? The product market fit. And it's so important to get it right, that I personally feel like that's where my engineering background also helped me quite a bit to have this kind of a application mindset when we're building this out.
Now, Doc, on the flip side of it, what are things that you would change, or things that perhaps you didn't do very well that you would do differently?
Yeah, so I would say, when you're training in medical school, what you don't get trained much in is people management. And yes, we're trained to deal with patients, and we, have good bedside manner and how to say and how to speak. But we're not trained very well to how to manage a cohesive team. And you're often just faced that in the hospital. And you have to work with the nurses, you have to work with physiotherapists, occupational therapists, And it's a whole different way of, how this team is run and structured. And the same thing, in startups is like you have to be able to manage a team very well, cohesively, keeping people united, keeping people on seeing what the end goal and result is. And this, of course, was a very, very important learning journey for me too, to see how do you make sure everybody's doing what they're supposed to. Everybody has clear metrics and clear targets, and at the same time, all those metrics and targets are aligned with what the company is hoping and achieving to do. So I still feel it will be a continuous learning journey, but I at least know like I'm way better than what I was when I started. And yeah, I would say, it's all these different skills that need to come together to make well-run companies.
Now, it's been a fascinating conversation, Doc, but before we leave, any final thoughts you'd like to share with the audience?
So I would say, we really feel that the world needs a solution like this, because there cannot be indefinite number of hospitals in the world. We will always face hospital shortages in almost any market, with the aging population, with the population growing, with more people being even involved in their own health. And it's so important to have a solution working for people, which is not just this one-off care that they can have with patients and doctors, but have this continuous journey being taken care of them with highly trained, highly skilled, and standardized healthcare professionals to manage their journey, and for it to be done at home. So essentially, that's what we're hoping for Speedoc to be able to do, to help as many hospitals, help as many patients create this very, very high standard of home-based medical and healthcare, which can really help the burden on the national healthcare system.
Now, Doc, thank you very much for taking your time to come on the show.
No problem, and really, really appreciated being invited on this show too, Brian.
I'm Brian Fernandez, and we've been speaking to Dr. Shravan Verma. He's the Chief Executive Officer and co-founder of Speedoc on BizTech's Asia's hottest startup show. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. It'll also be on our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in. Okay, I'm just going to now record an intro and an outro for the next show. So just to give you a context. Sure. Welcome to BizTech's, sorry, I'll do that again. Welcome to BizTech's Health and Wellness Show. Our guest for today is Dr. Shravan Verma. He's the Chief Executive Officer and co-founder of Speedoc. Founded in 2017, Speedoc is a virtual clinic and healthcare solutions platform that allows users to seek medical care and services right from their homes. Thank you for taking your time to come on the show, Shravan. I'm Brian Fernandez, and we've been speaking to Dr. Shravan Verma, the Chief Executive Officer and co-founder at Speedoc, on BizTech's Health and Wellness Show. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. It'll also be on our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.